Good evening, ladies and gentlemen. Welcome to our next episode, Lifestyle with Dr. Mobi. I'm Dr. Mobi, and today we have great guest about talking about elderly driving, which is one of the big issues at present time since most of our population is getting into that age where this is a big concern. What we are going to discuss is with one of the specialists who is a geriatrician board certified in geriatric medicine and is a medical director of the nursing homes. He's going to educate us about safety issues and how to deal with elderly parents or family members who are patients who wants to still drive, and also help them to actually get the resources to make sure they have the safety addressed. So, with these words, I welcome my guest, Dr. Jamil Ahmed. Dr. Jamil Ahmed, we welcome you.
Thank you.
So, tell us about yourself a little bit. What do you do?
Well, I'm an internist and also a geriatrician, and a large portion of my patients are elderly people, as expected. And you see a varied amount of complications and the problems that comes with age, and that's going to happen to all of us. And I'm seeing those people who are much elder than me right now. So one of the issues that I always face is when to tell somebody that you don't drive.
Oh, yeah.
It is a very difficult for emotionally for me and for the patient and the family, because I'm going to change their life completely.
Yeah, yeah. So that is so true. When I also encounter patients, they ask us, can I drive, and why I am not able to drive. For them, it's also very important about their independence. So we have to really feel their pain, because that's what gets them to the grocery store or gets them to the doctor's appointment. So it's very important to understand their concern. And so Dr. Jamil will help us to understand some of these safety issues. So tell us about the incidents. How prevalent is these driving problems right now, doctor?
If you just think of the demographic, the way it is changing, and in 2020, actually this year, the prediction is that our population will be over 50 million over age 65. And of that, 25 million will be over 75. And as I told you already, that thing changes as we age. What happens to the older people? If you think that what kind of problem they get into when they drive, if you look into the traffic violations, for the amount of miles they drive, their traffic violation is much higher. And also, they forget to yield to the other drivers in the road. So they make a mistake and get into their way. Another thing is that they always make a mistake when they're driving. They do not look at the other drivers, whether they're coming your way or not, and they just keep on driving and get into trouble. For driving, what we need? A quick response. And a good reflex, and the timing when to stop and not to stop. And also the good vision. And vision is a problem that we all see, and most of the people, and elderly people is, they all have the eyeglasses. We don't know their vision is perfect or not. And when the last time they went to the doctor to be checked. Another is when they on the road, they do not communicate well other drivers. So that puts them at risk.
So you think they're also, beside vision, their hearing is impaired, or probably they're not wearing their hearing aid, and before they left home they forgot?
Yes, that commonly happens. And if I give some historical issues that it came to an head in 1999. At that time, there was a car accident happened in California, and there is a girl named Brandy Joe. She died.
Oh, shit.
And driver's name was Byron Cox. There was a lot of issues that, how long older people should drive and things like that. and but that didn't pass.
Oh, that. Oh.
And few things they put on the bill for that was that everybody over age 75 needs to be checked, not only vision, their road test and also written test. That didn't pass because AARP was against it and mobilized the people very well.
Yeah, they are very strong.
And so that didn't happen. For compromise, what they got is a watered down version that for anybody over age 75 probably should get 8 hours of driving education. And it is shown that actually people who got the driving education for 8 hours given by the AARP actually did better than people didn't take. So there's something good came out of this, not the whole thing that we expected. So what happens when you tell people that don't drive? It is actually affects their independence. In various ways. How are we going to go to doctor's office? How are we going to go to friends' places? What they're going to play bingo? It doesn't matter that their social life, it is stopped all of a sudden. So that we have to think about. Not only that, when you stop driving, your self-esteem goes down a lot lower, and that's also makes you feel unsafe at home themselves. And we all know that people who fall a lot at home, they are also a bad driver.
So how do you think that your approach when family members tell you, I'm concerned or you're concerned, I'm sure when you check them that are you safe? So what tools do you employ asking family, or how do you tackle that?
Most of the family, probably 70% of the time, they already know that their parents probably should not be driving.
Oh, okay.
But they're afraid to offend them, and they usually come to the doctor and tell us that can you tell my dad not to drive? So you just can't tell your patient that stop driving, but you have to do some testing to tell that make sure that it doesn't have a dementia. So you check the memories, some tests that we can ask the question, what year is that, what month is it, and there's some number games to give how bad is the memory. Normally, if somebody scores less than 23, you know that they are pretty bad. They should not be driving. Over 23, they can drive with some modification in their life. So you check their vision, and they also you check their memory, as you say, asking the questions and things like that, and see how they're moving, whether have trouble getting out of the chair or turning the neck, because you need a good neck and the range of motion to see what's going on around your car. And also there's some risk factor they found out that somehow correlates with the driving issues and the accident and the aging. How many times did you fall in last 2 years? If you feel multiple falls, you should be one thing that you should be worried about. And also the blurring of the vision, and whether they had a car accident. Sometimes you will probably, family will tell you that I see a lot of brushes around the car. Looks like he had some near misses. And whether they're taking a lot of medication, that can compromise you how you think. Like one of them is a benzodiazepine that a lot of people take. If you have a psych histories and taking some older antipsychotic and antidepressant like a tricyclics, and those are also can compromise your driving. For some reason, male sex has more accidents than women. I cannot tell you why. But if you were a male and you live single, then you have a higher incidence of accidents. One medicine is shown that actually it does some good. Is one of the blood pressure medicine we call beta blockers, like Introl or low pressure or something that kind, which is somehow it comes down. It decreases your shakes for somehow that happens. But there's not sure why, but there's some significant correlation with that.
Correlation. So for audience to understand and digest all that, so what Dr. Jamil is saying, number one is, their cognitive eval, which is doctors actually eval by mini mental status exam. So what it means is we ask a couple of questions. We test areas in the brain which are for your concentration, for your memory, short term, a little bit long term, and then or remote memory, and then we score it. So if it's below 23, then it is a number where you should not be driving. Second is that medication profile is very important. So certain medication which people take for granted are really not good. So one of them is very common and it is very bad, is these antihistamine, which is Benadryl. So many people think Tylenol PM is a good medication to take to sleep. Not really, not for elderly, because it's going to impair your reflexes, and it has this effects to dry, and it lasts 24 hours. So, and if you have a prostate problem, which most men will have at that age, most likely you will have a lot of problems with it. Please do not take Tylenol PM. If you have to take plain Tylenol. Second thing is those other medication which are benzodiazepines, which are used for anxiety. Psychiatrists could offer that. Those are you should be very careful because they impair your reflexes. And the third are tricyclic, which are one class which we use also, which one happens to be Elavil. Those are also older medications, which been there for many centuries, but problem is they have really long half-life and lot of side effect profile. So eventually I will say medications, none are pretty safe, but some medication, Dr. Jamil indicated, like beta blockers, which is Indrall, low pressure, they tend to actually help for some reason more beneficial effect. We don't know why. Maybe they calm the heart down so they don't panic and they don't have these tremors, and that's going to help. So those are some of those which seem to help some of these patients. Other thing he pointed out is that men tend to have more accidents. So all those females out there, feel happy that you are a better driver than us for sure. So let's talk on the other issues you were telling us about, doctor. Go ahead.
Few other medical issues that you always comes up, whether it has a heart problem. And if you have some kind of heart problem, has problem with the heart rhythm problem, those are at risk for something happening when you're driving.
Okay.
So if you have a stroke and a weakness, it'll be difficult to drive.
To drive, yeah.
And history of seizure has always been a big no-no for driving. And so if somebody is having a seizure, automatically people not allowed to drive. Another thing is that diabetes. Not only diabetes, it is low sugar, which causes more problem than high sugar.
Yeah.
And nowadays we see that sleep apnea syndrome or issue with the sleep and being drowsy during the day, that puts you at risk for accident, and which is rather common nowadays. And the thing is, as I told you earlier, that arthritis, if you have joint problems, you cannot move your hand or neck, it makes you an unsafe driver. And if you look at just medications, young people don't take too many medications because they don't have any illness. But over age 65, almost 32% of all the medicine that is used in the United States are over age 65. And not only one medicine, they may be on multiple medication, and combination may be not good. Few medication that you already told is that a benzodiazepine like Ativan or lorazepam, or an antihistamine, the Benadryl, and anticholinergic that sometimes you have some medicine for bladder control, incontinence, that can have some effect that way. And it depends on the person how it activates these problems, and the pamela you already told. So you have to make sure that if you give somebody benzodiazepine, have to be very careful. But the 50% people will have an accident if they have an accident within first week.
Oh, wow.
So you have to be very, very careful what we give.
Oh, also, you were saying about these numbers about in 1970 versus 210.
And how the driving has changed. When you look at how many people used to drive in 1970s, only 50% people over age 65 drove. Compared to 2010, it is 84%. I'm sure after 4 years later, it is much higher because that's the way it is. People don't have the support system they used to, and they have to drive. Otherwise, they'll be completely socially isolated.
Yeah.
And we all know about alcohol.
Yeah.
And it is not a good thing, especially when you're driving. And before I tell somebody that please don't drive, you always has to ask about his social situation. How many support they have at home? Would they have any children around? If I tell him not to drive, who's going to take him to places?
Yeah,
those are the things that we don't tell people, didn't even think about. If somebody is driving, you have to be a safe driver. Make sure that he is using the seat belt.
Yeah, seat belts, yeah.
And if he's getting lost often, that probably should not be driving.
Yeah, shouldn't be.
And or having a close call. Didn't have an accident, but almost there. So those are the issue you have to ask about the patient, and they may not say that, no, I'm driving for the last 60 years. I know how to drive.
Yeah.
And that is a common thing that I hear.
That's same thing. So that's so true. So when we encounter these problems, we always ask, so did you have near miss? So you almost had accident but missed it. Other thing is, if somebody is honking at you and you didn't pay attention, or you're getting too many tickets, or any ticket actually. So those are important. Fender bender, and make sure you wear your hearing aid, get your vision checked. And also before you leave, make sure you know the way. Don't go too far. Don't drive at night, because that's very risky, and you should not be, because your reflexes are slow. So some of the factors which are important, like Dr. Jamil said, your reflexes are slow, and so hearing and vision are another problem. So make sure you pay attention to all those, because and you ask yourself, are you putting yourself and others at risk? Then if answer is yes, maybe you shouldn't be driving. And there are other states which Dr. Jamil will also educate us, that where they can revoke their license actually too.
Yes.
So tell us about that, Doctor. So certain states...
Pennsylvania is one of them. And California, Delaware, Nevada, New Jersey, and Oregon. And if you think that somebody is not a safe driver, you have to inform DOT or Department of Transport. And even before you tell them, you still continue to see how bad it is. And so one interesting thing that happens as you get older is our hand grips gets weaker.
Okay.
So that makes it difficult for us to hang on to the steering wheel.
Yeah.
There is a number that you need at least 35 pounds of grip.
Oh, okay, that's good.
To have a safe driver. Then also have a range of motion of the neck to have to make sure that it is okay. For the balance, you can tell them walk for 10 feet and come back. And if they can do it in less than 15 seconds, they're at a better group of the people. They are less likely to have an accident. Or vision has to be 20/40. Or peripheral vision is 120. So how much, when you look straight, what the angle you can see.
Yep.
It is more than 120. Excuse me. A lot of people can't do that. It happens so slowly, and they don't know. And there's more accident due to peripheral field issue or how much they can see than the blurring of the vision. So that is important. And I always talked about that your mini-mental test has to be more than 23 to be a good driver. And it is a complex test, but simple to do. It takes several minutes. And to see how is the memory. And there's function of the higher function of the brain that they'll check. But that is a rough way to tell how good they will be able to drive. So, but it's the worst thing is how to tell people don't drive. But you can give the facts and the figures and tell that you're not only put yourself at risk, but everybody around. And as a physician, I will not be able to give you the license because it will come back to me.
That's of course. So I think we'll just wrap up now the session. So I will summarize and first have after Dr. Jamil summarize it. So any more you want to give some final thoughts on this topic, Doctor?
There's a lot of unorthodox way of stopping driving. Most of the time, family always do. They hide their key.
Oh, they hide the key. Okay. So
or disabled. Some people are smart. They have a spare key, so they will probably unplug the battery.
Okay.
And somehow so that they cannot take the car out.
Okay. So those are, I think, good. So for some final thoughts from my side, make sure look at their profile. So if they are having near misses or accidents, or honking or getting too many complaints from neighborhood that they missed the sign, maybe it's time to pull back and reevaluate and just make sure, because there are a lot of people around. They could be kids, and then they could ignore them, and then they feel bad that they ended up in accident. So with those in mind, make sure there are few resources for AARP, then National Highway, and then elderly care. So the addresses, all those are on my slides. Please feel free to give us Twitter feedback and so forth. And so it's always been pleasure to see all questions coming, and then we'll be happy to answer all those for you. Thank you once again for watching our show, and good night, Dr. Mobi. Checking it.
Thank you.
Thank you.